Have you ever craved ice? If you have, you probably should have your iron levels checked. This is actually an example of something called pica. Pica often is a symptom of iron deficiency. But with pica, people don't necessarily only crave ice. Sometimes people crave other sort of non-food substances, things like clay, craving paper or dirt, or craving things like chalk or ashes, even charcoal, coffee grounds, even baby powder. This is a real thing. Okay. So if you've ever heard anyone in your life say, gosh, I just keep chewing ice, or I just, clay or whatever it might be, this is actually very real. And it's actually a relatively common symptom of iron deficiency. Any of these cravings should prompt you to get checked for iron deficiency. I'm going to tell you other symptoms you really need to know about. Guys, I'm Dr. Jen. It is good to see you. Iron deficiency can happen with or without an anemia. And for those people who have an iron deficiency without anemia, oftentimes, if it is untreated, left untreated for long enough, and the underlying cause is not corrected, the person often then develops an anemia. This is the thing. Iron deficiency is more common in women than in men. And it's more common in menstruating women and pregnant women than other populations. Other people who tend to maybe be higher risk for getting iron deficiency would be older adults, athletes, Black and Hispanic races more so than other races, people who donate blood frequently, and others. But let's go back to the symptoms, all right? We talked about pica. Another symptom that might surprise you is restless leg syndrome. This desire, this instinct or impulse to move your limbs during periods of inactivity. Restless leg syndrome could actually be a sign or symptom of iron deficiency. Another big one, how many of us talk about our hair and have gone through hair thinning or hair loss? I certainly have in my life at different times. Hair thinning, hair loss can actually be a result of iron deficiency. So it tends to be a lab that we may check for if you complain of hair loss. Very important to know. The next thing is fatigue, okay? And by the way, in no particular order, but you can have fatigue due to an iron deficiency. You can also have, and this is not everybody with iron deficiency. By the way, none of these are necessarily everyone with iron deficiency. But there is, interestingly enough, a condition called beeturia, Beeturia. And this is when your urine turns red after eating beets. This phenomenon can happen in a certain number of people who have iron deficiency, which I think is really interesting. Other symptoms that have been associated with iron deficiency are symptoms such as depressed mood, hearing loss. These are things that have been reported, and there are likely many other symptoms as well. The good thing is that there are tests for iron deficiency. So you're wondering, well, gosh, some of this sounds like me. What do I do? Well, talk to your doctor, okay? There are tests for iron deficiency. We can check iron levels, ferritin levels, transferrin levels, an iron panel, blood panels, CBC. There's all sorts of stuff we can check, okay? So we can actually check your labs to see if you're iron deficient. And if you are iron deficient, by the way, there is treatment, okay? We can get you iron, and there's multiple different ways to do this. One thing I will say is that iron replacement, I have a video just on how to take iron, because it can be tough on the stomach if it's taken orally, but there are other ways too. So I've got some tricks up my sleeve, some evidence-based tricks that may help you if this is you. I will make sure I link a video here. If you're watching on Facebook, just message me and I'll send you the video. Let me know if you have iron deficiency. Write in the comments. Share this video with anyone who might benefit from it. I'm Dr. Jen Caudle. Please subscribe to my channel. Follow me on Facebook. I'm on Instagram, LinkedIn, TikTok, Threads, Twitter, you name it, all of it. And go to my website, drjencaudle.com, to sign up for my free health newsletter.